5 foods to avoid when pregnant and why pregnancy is a difficult time for many reasons. One of the stresses that pregnant women deal with is keeping their diet in check. It's not always easy to stay healthy throughout the pregnancy because there are so many things to avoid. But it can be done with some careful planning. There are 5 foods that pregnant women should never eat, and here's why. Raw egg or egg products like mayonnaise because they can contain salmonella bacteria. Soft cheeses because raw milk contains listeria bacteria. Fish that is high in mercury, such as tuna. The risk of mercury outweighs the benefits of eating fish for pregnant women, which include omega-3 fats and protein. Although these types of fish should still be eaten in moderation by doctor consultation. Understanding the foods to avoid in pregnancy is a time of huge changes. As your body and life change, the food you eat also changes. This video provides a list of foods to avoid during pregnancy to help you have a healthy and happy pregnancy. A pregnant woman has a lot on her plate. Never mind the morning sickness and cravings. Now she has to think about what she should and shouldn't eat. The following foods are those that should be avoided at all costs during pregnant. If you're expecting, it's important to know which foods and drinks you should avoid. Read on for a list of foods and drinks to avoid during pregnancy. Research suggests that exclusive breastfeeding for 6 months is the best thing to do for your baby. It provides infants with the best protection against diarrhea and respiratory tract infection. Breastfeeding also provides children with lower rates of obesity, type 2 diabetes, and high cholesterol in adulthood. There are some foods that pregnant women should avoid during their pregnancy. Eating these foods can lead to an unhealthy pregnancy and even miscarriage. Pregnant women should not eat soft cheese or blue cheese, soft and processed meat like ham, pâté, salami and sausages, unpasteurized milk and eggs, raw fish and shellfish like sushi and sashimi. Pregnancy is a time of excitement, but there are certain foods to avoid during pregnancy. There are 2 main objections to eating these Indian foods in pregnancy. 1. Foodborne infections. Indian food can include vegetables, which can be contaminated with harmful bacteria such as E. coli, salmonella and listeria. 2. Intestinal problems. Certain spices and ingredients in these dishes could cause intestinal problems for pregnant women, such as indigestion or constipation.
The following Indian foods should be avoided in pregnancy. Fenugreek seeds is a natural herb and seeds are used commonly in Indian cooking. Pregnant women should avoid eating fenugreek because it will increase the chances of bleeding during childbirth. Coming to nuts, the dangers of certain nuts when it comes to pregnancy is unknown, but there have been a few cases where pregnant women have had a miscarriage or a preterm birth after eating peanuts, almonds, and pistachios. Coming to raw vegetables, eating raw vegetables can cause an infection called listeriosis, which can cause miscarriage or preterm birth. Cooking the vegetables will kill the bacteria, so they are safe to eat when they are cooked thoroughly. Pregnancy is one of the most challenging times for a woman. It can be both physically and emotionally draining. Maintaining a healthy diet is crucial during this period, and there are certain foods that should be avoided if you don't want to risk your baby's health. We take a look at some of the Indian foods which should be avoided in pregnancy, like fish, shrimps, prawns, crabs, chicken and meat dishes cooked in curries. One of the most common questions that pregnant women ask is what they can and cannot eat. This video has a list of fruits that pregnant women should avoid and explains why. According to the American Pregnancy Association, you can safely eat all types of fruits during pregnancy unless your doctor says otherwise. However, some fruits do contain higher amounts of sugar and should be avoided for different reasons. What are the fruits to avoid in pregnancy? Limit fruit juices. You should drink water instead of juice due to the high sugar content. Avoid berries. eating certain types of berries may lead to an increased risk for miscarriage or premature birth because they are high in antioxidants, which may be harmful to the fetus. Limit citrus fruit. Citrus fruit is acidic, which may make your stomach feel worse or could lead to heartburn. Prenatal food guidelines and what you need to know about dietary patterns in the first trimester of pregnancy. Pregnant women should avoid eating raw or undercooked meat, poultry, eggs, fish, and shellfish due to the possibility of foodborne illness. They should also avoid eating raw or undercooked vegetables that may have been fertilized with human manure. The National Association of Boards of Pharmacy warns pregnant women about consuming unpasteurized milk because it could contain bacteria that could cause listeriosis. Listeriosis can result in miscarriage, stillbirth, premature birth, and serious illness among newborns. The fruits to avoid in pregnancy are not limited to green or unripened fruit. It is important to avoid the whole of the produce that has been mentioned above, as it could be contaminated with things that can harm your baby. In general, you should also try and stay away from anything that is not in its natural form or state. Processed foods, such as fruit juice and canned food, should be avoided because they often contain sugar and sodium. If you are craving something sweet in pregnancy, it's best to eat a piece of fresh fruit rather than a processed food, which could increase your sugar levels and make you feel guilty later on about how much sugar you have eaten.
For more information and updates, visit our website babyneed.in. Thanks for watching this video completely. Please like, share, subscribe to our channel for more videos.